Namaste and thank you for joining. Today, we are going to discuss one of the most important topics, high blood pressure. Along with diabetes, cholesterol, and smoking, it's one of the four major risk factors for heart disease. So many people have asked me before about blood pressure, how to control blood pressure without medicines, how to complement lifestyle with medicines to control blood pressure. So that's all we're going to discuss today. The first thing I want to discuss is why the high blood pressure is called a silent killer. It's called silent killer because it gives you for a long time no symptoms. You may have high blood pressure and you may have no symptoms. So you may feel no urge to consult a doctor and may never know that your blood pressure is high. And inside, it is doing serious damage. So what it does is it's quietly damaging your arteries, damaging your heart, kidneys, brain, and eyes. And what do you end up with? You end up with a heart attack, a stroke, failed kidney requiring dialysis or kidney transplantation or loss of vision. Now, who is at risk? I think everybody is at risk. Everybody. Now, people that have unhealthy diet, stressful living, obesity, inactivity, or a family history of blood pressure have more predisposition to have this problem. So how would you then find out? The best way is regular blood pressure check. It's simple, inexpensive. You can buy your own equipment or equipment in the neighborhood or with some friend and check your blood pressure. And check it every 6 months to 1 year to make sure that you're not developing blood pressure, because as your age advances, your chances of getting blood pressure go higher. The statistics for India are frightening. 1 in every 3 adults in India has high blood pressure. The problem is 2 out of 3 do not know. So almost 67% adults in India that have high blood pressure do not know that they have high blood pressure. Even when they find out that they have high blood pressure, they're not changing lifestyle, and only 1 in 5 is taking medicines. So 20% treat it, 80% don't treat it. Of that 20% that treat, only 1 in 10 has the blood pressure controlled. So you can see so many people don't know their blood pressure, so many don't take medicines, and even after taking medicines, so many are not controlled, and that is the problem. Now, when you're past 65, you're a senior, right? Half of India's seniors have high blood pressure. Even in young, 1 in 5 young people have high blood pressure. And the problem is that there's not much difference in blood pressure in the rural or the urban people. The rural, 1 in 4, 1 in 5, urban, slightly more than that. So it's really scary. So going into the mechanisms, majority of the blood pressures have no definite cause. When I say cause, is a treatable cause, like an endocrine problem or a kidney problem, which happens in about 2 to 4% people. 95% people have blood pressure, which is called essential blood pressure. So how does it happen? So I'll take you through a little bit of anatomy and physiology. Two things you have to understand, and I discuss that in all my programs. One is called endothelium, and the other is called nitric oxide. So what is endothelium? Endothelium is the one cell lining inside your blood pressure, your blood vessel. And this is lining all the blood vessels of the body, the big, the small, the arterioles, the capillaries, everything has this lining. And this inner lining of the blood pressure, the endothelium, is actually the brain of the blood vessel. It is not just a layer of blood vessel lying in there, just like a carpet. It is active. It can secrete substances, hormones. It's like an endocrine organ. And it has the capacity to release certain substances. And the most important of that is called nitric oxide. Nitric oxide is a natural relaxer of the artery. And this is a natural blood pressure control medicine. If you have blood pressure, remember, two things have happened already. Your body's capacity to produce nitric oxide has gone down, and your blood vessels' capacity to respond to nitric oxide, the endothelium, has lost its function. So by the time you have blood pressure, all the blood vessels in your body have gone through two changes. They have become old, which means they have become hard and inflexible. And they may also be having some deposits of substances in them, like cholesterol or inflammation, which is causing narrowing in the blood vessels. So these hard, inflexible, narrow blood vessels are the cause and the result of high blood pressure. So what do you need to do? You need to make sure that your blood pressure, your blood vessels are flexible, stretchable, and can expand in response to high blood pressure. So some of you who have read some physics in high school may know, you put water in a pipe. If the pipe is stiff and has no capacity to expand, if you increase the pressure of the pipe, right, to some extent it'll bear it, and after that can rupture. But if the pipe can relax, like a rubber pipe or a plastic pipe, then it can absorb the pressure, and the pressure of the water inside the pipe will not go up. So the important thing is, whatever you do in your life, make sure that you have abundant supply of nitric oxide. Anything that results in the supply of nitric oxide to go down, you should avoid. You should keep your endothelium healthy, not let it get damaged. So healthy lifestyle that we talk about in our program, the DASH pillars, the 10 pillars, that is the lifestyle that creates strong endothelium, more nitric oxide in your blood vessels, flexible arteries, stretchable arteries, and normal blood pressure. So before we go further, some simple things that you need to understand. How do you measure blood pressure? So when you check your blood pressure at home or you go to your doctor, there are certain things that you need to follow. First of all, sit down and relax for 5 minutes before you check your blood pressure. Don't just jump into a room and put the blood pressure cuff on and start measuring. It's going to be high. 5 minutes, relax. Before you check your blood pressure, make sure that you have avoided caffeine. You have not had too much tea or coffee. You have not smoked a cigarette, and you have not exercised, and you have not had alcohol. Make sure before you check your blood pressure, you have urinated and your bladder is empty. Then you sit comfortably. Your back should be supported. Your feet should be flat on the floor, both of them, no cross legs. An arm should be supported at your heart level on the table that you're sitting on. So this is the posture that you should have when you check your blood pressure. Make sure that you have a calibrated and validated blood pressure measuring instrument. Most of these at-home blood pressure instruments, after 3 years, their diaphragm becomes problematic. So every 3 years, change them. Make sure you buy a standard quality blood pressure instrument. One very important thing is, if you have high blood pressure, when you go to your doctor, make sure you take your own instrument with you to the doctor. And when the doctor checks with his instrument, you also check with your own to make sure that its calibration is proper. Also make sure that the blood pressure cuff that you use, the cloth that you wrap around your arm, its length and width are important. The bladder should be at least 80% of the arm circumference, and it should be 40% of the arm circumference in the width. If it's too small or too big, it is going to give you wrong blood pressure measurements. So you put the cuff in the upper arm. Now remember, there's always be a difference in blood pressure in the two arms. Whichever blood pressure is high in whichever arm is the one that you should always use. So let us say you measure your blood pressure in right arm and left arm, and there's a 10 millimeter difference. Right arm is 10 millimeter higher. Then you always measure your blood pressure in the right arm. Wherever it is high, that is the one that you measure. You inflate the cuff 20 to 30 millimeter above where your blood pressure is, slowly deflate and check. Now, take two readings, 1 to 2 minutes apart. If they are more than 5 millimeters away, take two more readings. So the two of the closest readings that you get, you average the two, and that is your blood pressure. So that is how you measure blood pressure. Now, what is high blood pressure? Now, this is changed a lot. And I tell you why it's important to know what I'm about to tell you. A blood pressure of 120 or below systolic is called normal systolic blood pressure, and a blood pressure of 80 or below diastolic is called normal diastolic blood pressure. Now, there's a linear relationship. If it starts climbing up above this, with every 1 to 2 to 5 to 10 millimeter rise in blood pressure, your risk of those problems that I told you, the arteries, the heart, the brain, the kidney, the eyes, all the problems that come in these organs rises in a linear fashion. So when you say normal blood pressure, it should be below 120 over 80. If it goes above 120, but it's below 129 systolic, it is called elevated. Diastolic could still be 80. Now, if your blood pressure goes above 130, now it is called stage 1 blood pressure. 130 to 139 systolic, 80 to 89 diastolic. If it goes above 140, you're already in stage 2 of the high blood pressure, 140 over 90 and above. If you go above 180 over 120, it is called severe blood pressure or blood pressure crisis. Now, a lot of patients come to me and they say, sir, my blood pressure is okay, about 140 over 88, 140 over 90. So from what I've just told you, this is stage 2 hypertension. At that blood pressure, you're going to cause problem to your blood vessels, heart, kidney, brain, eyes. So what is the answer? The answer is to come as low as you can without having side effects, even below 120 over 80, to be safe. All right, so the topic today is the natural ways of reducing blood pressure without medicines. So first of all, let me talk a little bit about the medicines. When you are diagnosed with blood pressure in severe range, take medicines, because these lifestyle things will take time to function, and you don't want to roam around with a blood pressure of 200 over 100. When you take medicines, you have to understand that each blood pressure medicine lowers blood pressure by only 10 to 15 millimeters of mercury. So let us say your blood pressure is 160, but your goal is 120. So you're 40 millimeter high. If the blood pressure is 40 millimeter high, you need 3 to 4 blood pressure medicines. And that is why a lot of patients in India have a problem. They say, Sir, doctor ne dawai diya, gave me some medicine, but my blood pressure didn't get controlled. Well, if you have to lower 40 millimeter, one blood pressure medicine is only going to lower by 10 to 15. It is not going to lower 40 millimeters. You'll need 3 blood pressure medicines. And you need to take them on a regular basis. So that's one important thing. When you start the lifestyle, the changes that we're going to talk about, the 8 important lifestyle changes that I'm going to discuss with you today, together they can lower your blood pressure by 40 millimeters of mercury. So if you are a blood pressure patient with a systolic blood pressure of 160, if all the things that we are going to discuss today, you do 100%, you can lower your blood pressure 40 millimeters, which means equivalent of 3 blood pressure medicines. So lifestyle properly practiced and followed long term is almost like taking 3 blood pressure medicines to control your blood pressure. Okay, so number 1 is weight loss. If you are overweight and have blood pressure, there's a good news for you. And the good news is every 1 kilogram weight that you lose lowers your blood pressure by 1 millimeter. So if you're 10 kilo overweight, you can lower your blood pressure 10 millimeter by bringing your weight down by 10 kilograms. But there's a ceiling. If you're 30 kilograms overweight and you lose 30 kilograms, you're only going to lose about 10 millimeter in blood pressure. It's good to lose 30 kilograms, but there is a ceiling of 10 millimeter on blood pressure loss. And that's a lot. That's almost one medicine, right? So if you're overweight, you lost 10 kilos, lost blood pressure 10 millimeters, it's almost like taking one medicine. Now, a little bit about something that is becoming very fashionable these days, and I'm going to do a separate video on that very soon, is the medicines, the most popular being Ozempic, called the GLP-1 inhibitors or glucagon peptide. This medicine now is the largest selling medicine in the world. There's no doubt it causes weight loss of 10 to 15 millimeters without you doing anything. Okay? Also, this medicine improves your diabetes, lowers your insulin resistance, reduces inflammation in the body, and does a lot of other protective things. But there are some side effects also that are coming these days, besides this being expensive. How about if I tell you a free natural Ozempic with no side effects? A free GLP-1 inhibitor with no side effects. So how do GLP-1 drugs like Ozempic work? Simple. They work in 4 places to give you the benefit. Number 1 is they tell your liver, do not produce any more glucose, called neoglucogenesis. So the sugar levels drop. They tell your pancreas, secrete more insulin. So that controls your blood pressure, improves your resistance. They tell your brain, you have eaten enough. Don't eat anymore. So they cause satiety in the brain. And they work in your gut, intestine. By the way, that is where they are produced also. And they prevent absorption of too much food that you eat. So through these 4 mechanisms, they control your diabetes, inflammation, insulin resistance, and weight. So we recommend in our program green leafy vegetables, legumes, fruits, right? All these things that have 2 things in very large quantities, the fiber and the phytochemicals. So if you are eating large amount of fiber, there are some friendly bacteria in your intestine that love that fiber. They eat that fiber. When they eat that fiber, they produce certain chemicals in your intestine called short-chain fatty acids. And these short-chain fatty acids works on certain glands inside your gut, and they produce same GLP-1 that Ozempic produces. So this is natural. So just by eating fruits and vegetables and legumes, you can have Ozempic-like effect through Ozempic-like mechanism, and you don't need to take Ozempic. So that's about weight. Number 2 thing that makes you lower your blood pressure by about another 10 millimeters of mercury is the diet, whole food, plant-based diet. Now, what is the best diet? The best diet for you is what is natural to your environment, your family, your community, your city, and your state. What your ancestors have been eating for a long, long, long time, because that has undergone all the genetic changes that you have to undergo to become accommodated to those nutrients. With 10 principles that we say to modify. So what are the 10 modifications? 10 modifications is eat green leafy vegetables, switch your grain to whole grain, eat legumes, chickpeas, beans, chana, black, white, green, kidney beans, pinto beans, black beans, and all the pulses, all the dals. Okay. So green leafy vegetables, fresh fruits, legumes, and whole grains. These four are the key ingredients that help you lower your blood pressure through many mechanisms. One I already discussed, they give you the natural Ozempic, right? Along with that, salt, oil, sugar, these three things you minimize. And along with that, minimize dairy, full fat dairy, animal product, and processed food. 10 things. So you're eating everything that you're eating. Just change it with these 10 principles. Eat the same idli that you're eating, eat the same sambar that you're eating, minimize the oil, minimize the salt. Eat the same chapati that you're eating, make it whole grain. Eat the same vegetables that you're eating, go towards green leafy and colored vegetables. Eat the fruits, local, seasonal, available. Maximize legumes for protein intake, right? Switch your dairy to low fat. Minimize animal food. Don't eat processed food because processed food is loaded with salt, oil, and sugar. It's as simple as that. And that's 10 millimeter drop in blood pressure. So you've already lowered your blood pressure by 10 millimeters. So green leafy vegetables are rich in nitrates and potassium, two things. Nitrates, remember, nitrate is nitrogen, is the precursor of the nitric oxide that I talked about, right? So it's natural that it should provide more nitric oxide because it provides more nitrates to you. I'll discuss shortly about the potassium. These two relax the endothelium and lower the blood pressure. The whole grains also reduce the blood pressure because they provide a lot of fiber. And then fiber gives you all those benefits that I talked about before. Fruits are loaded with potassium and antioxidants that balance sodium and support your vascular health. Oil, if you reduce, vascular elasticity improves. If you reduce salt, there is less sodium in the body and the blood pressure lowers. If you reduce sugar, your insulin sensitivity improves, inflammation goes down in the body, endothelial health improves, and the blood pressure improves. If you eliminate dairy, especially saturated fat dairy, again, you have the same effects. You're reducing the inflammation, improving insulin sensitivity, and you're improving the blood pressure. If you eliminate animal food, you reduce the cholesterol in your blood vessels, you reduce the inflammation in your blood vessels, the vascular inflammation goes down, atherosclerosis goes down, blood pressure becomes better. And the processed foods, by cutting back salt, sugar, and fat, cause all the changes that I talked about above. And how we go further, 10 we have done with weight loss, 10 we have done with whole food plant-based diet. Salt is the next thing. And if you minimize salt, you can reduce another 5 millimeter blood pressure. So what does salt do? Salt retains water. The blood volume goes up. If the same blood vessel that has a blood volume of 5 to 6 liters now has 7 liters, the pressure will go up because pressure is also a function of the volume that is circulating in the blood vessel. If you take too much salt, the vessels tighten, shrink, they don't relax. The kidneys don't work better because they have less salt to filter. They can create fluid balance in a better way. Swelling in the body goes down, okay? Stiffness in the vessel goes down. So all these things improve when you reduce your salt. Now, if you switch your salt to potassium salt, so you can get potassium from two sources. I told you all fruits are rich in potassium, so that's natural potassium. But what I recommend in my program is to tell patients to change from sodium chloride salt, the normal salt, to potassium salt, potassium chloride salt. This is also salty. By doing this, you've done two things. By reducing sodium, you have lowered the blood pressure by 5 millimeter. And by switching to potassium, you lowered another 5 millimeter. So that's 10 millimeters. Just this switch. All you have done is changed your home cooking salt from sodium salt to potassium salt. Now, if you are outside India, let's say in the United States, you can get 100% potassium salt, called the new salt or potassium salt. In India, the highest you can get is 30% potassium salt. It comes from Tata Superlite 30. Now, there's also 10% Tata Light 10, but Tata Superlite 30 has 30% potassium. That's the highest you can go in India. Make sure that in your entire family that is eating from that kitchen, nobody has kidney disease, is not retaining potassium, because if you change to potassium salt, you'll increase the potassium levels in their body. So if everybody in your home is healthy, they don't have heart failure, heart disease, switch from sodium to potassium salt. And there's a 10%, 10 millimeter drop in blood pressure right there. Okay? Next comes the role of exercise. So there are three different types of exercise. Together, they can lower the blood pressure by 15 millimeters of mercury. And they're called aerobic exercise, dynamic resistance exercise, and isometric exercise. I'll explain what it is. Aerobic means where you are increasing your blood pressure, increasing your heart rate, and increasing your respiratory rate. Walking, cycling, running, swimming, dancing, playing sports, badminton, etc. That's all aerobic. They strengthen the heart, improve the blood flow, increase nitric oxide production, restore the health of the endothelium, and they decrease about 5 to 8 millimeter blood pressure. If you're elderly, I tell you the simplest aerobic exercise is walking, brisk walking. It has all the benefits of aerobic exercise. I'll come back later to my program, what we do in my program. We do recommend yoga, meditation, pranayama, which has everything included. Dynamic resistance. So dynamic resistance exercise is like weightlifting, push-ups, squats, resistance, or bands that you do. All these things that you do in the gym or at home. They build muscles, they make the blood vessels flexible, they reduce weight, and they reduce blood pressure. And the third is called isometric. Isometric is where the muscle length doesn't change, like you do wall sits, sitting against the wall, hand grip exercise, or planks, right? And they also train your blood pressure to relax, improve the nervous control of blood pressure, and lower the blood pressure by 5 to 6 millimeters of mercury. So this is complicated. I have simplified it in my program. If you're walking briskly 7,500 steps a day, and you're doing the yoga, meditation, pranayama that we do in our program, all this is covered and more. Why? Because yoga, especially Surya Namaskaras, if you're doing in repetition, is aerobic exercise. You do dynamic exercise, resistance exercise in yoga, right? You do plank, falakasana, or you do your downward dog, or you all these exercises that you do. For example, your Virabhadrasana, right? These are all dynamic resistance. Isometric resistance. When you go through the whole chain of Surya Namaskara, you added both dynamic and isometric resistance, because a lot of these, you're supporting your weight on your hands, on your ankles, or your hands and your knees. And all these, you are causing increasing resistance in the body and getting those benefits. So if you're doing 7,500 steps a day and doing yoga, meditation, pranayama, all the benefits are covered. All right. So walking, there have been many studies now that have shown that walking can even reduce the risk of heart disease by 30%, 7,500 steps a day. It strengthens the heart, improves nitric acid production, improves endothelial function, reduces inflammation in the body. In addition, all these things that I told you, the exercise or the yoga, meditation, pranayama, or walking, it also improves your mood, improves your sleep, And in addition, is also lowering your risk of stroke, diabetes, and heart disease. So many benefits. In our yoga, meditation, pranayama, I already told you, there is stretching, there's relaxation, and there is breathing. So when you do meditation, right, it calms your mind, your stress hormones go down, adrenaline, which constricts your blood vessels, cortisol, which causes inflammation and increase in sodium in the body. It also improves your emotional balance. So when you do pranayama, slow breathing, oxygenation improves, body relaxes, sympathetic drive goes down, parasympathetic drive increases. All this relaxes the blood pressure, lowers the heart rate, removes the blood pressure spikes, and bring your blood pressure down. So this benefit of yoga, meditation, pranayama protocol that we use adds up more on top of the exercise that you do to lower your blood pressure. So the last is alcohol. Now this is becoming a bigger problem in India. The alcohol intake in India is on the rise. Alcohol puts strain on the heart. It directly reduces the efficiency of the heart muscle. It makes the blood vessels more stiff by increasing blood volume. It increases the fluid in the body. It increases the production of adrenaline and cortisol. It actually can sometimes impair your sleep if you drink too much. It makes you eat more and your body weight goes up. And then also strains your heart by straining your kidneys and liver. And cutting back alcohol or giving it up gives you another 5 millimeter reduction in blood pressure. So we've done 10 millimeters by weight loss, 10 by diet, 10 by exercise, 5 by sodium, 5 by potassium, and 5 by giving up alcohol. So you've already 40%, 40 millimeter reduction in your blood pressure naturally without any medicines by following what we said. Thank you very much.